Hi, I'm Beth Gaddis, the Vice President of Marketing at Patient Prism, and I am delighted to welcome Janet Hagerman to our studio today. I am so glad you could join us.
Thank you, Beth. I'm so glad to be here.
Well, Janet and I have known each other for years. She is an international speaker, an author, and a consultant, and the book that you wrote is called Selling Dentistry Ethically, Eloquently, and Effectively. Tell us a little bit about how you got into this.
Well, how I got into it was as a result of dentists asking me, when you come into our office to work with our team, is there any way that you could please teach my team how to sell dentistry? Because I know dentistry is walking out the door. I either hear things that I wish I hadn't heard, or I don't hear things that I wish I had heard. And I know that patients aren't getting the treatment. So could you please teach us how to sell dentistry, but don't say sell.
You know, a lot of people think that patient education is what makes the difference. What is the difference, in your opinion, between patient education and selling dentistry?
Great question, and there is a distinction. I mean, we're thought to think that patient education is the holy grail. If we just educate our patients enough, they'll get it. So we end up telling and educating and educating and educating. There's this saying that real education is not the filling of a bucket, but the lighting of a fire.
Okay.
So how often do we fill our patient's bucket? I mean, I once had a patient tell me in my early days, please just dispense with the lecture, stop talking, and just hurry. I need to get out of here and go to an appointment. So that was a great example of me filling his bucket.
But it was kind of going over his head. He wasn't buying
ready.
into it.
Well, he wasn't ready. He wasn't in a place to hear from that.
Right.
So I'm not saying that patient education doesn't have its place. It definitely does. But before that, we need to pull back and meet our patients where they are. Mm-hmm. So the goal of selling dentistry ethically, elegantly, and effectively is not just educating, but when the patient says yes. The patient says yes to treatment. I want it. I'll schedule it. They come in for their appointment and they pay for it.
But that's very important, that last part of it. So tell us a little bit about the average treatment acceptance that most practices have.
According to surveys done by Dental Economics, the average case acceptance is 30 to 50%, which is really low.
It seems like that would be really surprising to a lot of people.
Mm-hmm. I would recommend that everybody track their case acceptance. Find out, because this is what you hear a lot. Most of our patients accept treatment.
Right.
Most of them do, and it's sort of anecdotal. It's what you feel, but as you know, what gets measured is what
measure what you want to manage. We say that
exactly,
all the time.
Exactly. So it's really helpful to find out, well, what is our case acceptance? And the 30 to 50% is 50%. Patients of record and only 30% with new patients. So think about that. The opportunity for revenue, for one thing, the revenue that you're leaving on the table when half or over half your patients don't accept treatment.
Right.
And then also the patients that are not getting the treatment that they really need.
Right.
So, I mean, I don't need to tell you how much we spend marketing to our patients, trying to get patients in the door, and then Patient Prism is so excellent at helping offices translate those patient calls that we've gotten from marketing to actually an appointment.
Right.
So what happens when they actually make it to the appointment and step through the door? Too often, as those statistics show, they're in the front door and out the back door because they just didn't get them to the point where they could commit. So how do you change that?
Could you give us an example of where somebody might be presenting something in a patient education mindset versus how they might present it in this selling dentistry ethically mindset?
It's all soft skills.
Okay.
People make buying decisions based on emotion.
Right.
And nothing's more emotional than dental work, okay? I mean, you're talking about an intimate part of the human body here. Right. And you're talking about a patient coming in for the first time, and then, we present them with all this treatment. So I have, and we can talk about that, different strategies and techniques for how you prevent without overwhelming. But the first thing is we talk too much.
Really?
We just talk too much, yes.
Okay.
So we need to pull back. There's an old saying, if you want to sell, ask, don't tell.
Okay.
And there's a lot of truth to that. So how do we meet our patients where they are?
So find out why they came into the practice, for example. It might not be because they want to get a crown. It might be because they're going to their son's wedding. and they want to have a smile that they're proud of from the pictures. Would
Absolutely.
that be an example?
That's an example. And also future, what's your big goal for yourself?
Right.
So we can talk about that in a few minutes too, about values questions
Mm-hmm.
and then how you apply that to how you present treatment. Because there's this thing called information dosage, and different people accept information at different rates. So how do you find out what your rate is as opposed to your rate? How do you determine what that dosage should be? For one person, it would be overwhelming. For the bank president that I just gave you, it was like, I don't want to hear about it. For somebody else, it might be, you know what, Beth, I trust you totally.
Right.
So if you tell me I need a crown, you don't need to explain it to me. I'll do it. And then for other people, they may need a lot more information. So you need to figure out how do you meet the patient where they are.
My last question for this segment is, do you find that disc profiling and other methods of being able to tell what kind of personality type the person is that's in your chair makes a big difference in how you're selling to them?
Absolutely, and not just disc profiling. There's a lot of different methods that you can use. Some are very simple, but I think a lot of it is, number one, being aware of what you are. So I, for example, am sort of a high D, sort of. Is there a sort of on that? And then the other part is being aware of, you don't even have to get specific, you might have been trained in disc profiling, and that's great. You might have been trained in something else, but just being aware of what that person's demeanor seems to be. Right. So I know someone who's a little more quiet, that I need to tone myself down a little bit to meet them on their level. And the opposite too, if you're a more shy, retiring person, then you might want to up your energy level a little bit when somebody like me walks in the room.
Right.
So people relate better to like personalities. So it's just that's a big part of it, is that awareness for sure.
Now I know you have your own video series as well, where you talk about a lot of these topics. Can you share with the audience how they can find out more about this?
I do. It's free mini-series of 3 videos. They're only 5 minutes long, not unlike these. Yeah. And it's just designed to be able to watch during a lunch break and just get a few quick little tips that can be used by anybody in the office. My strategies, you don't have to be a salesy type personality.
In fact, it shouldn't be.
Exactly. So any personality can use these strategies and be successful. www.sellthatsmile.com, and my website is janethagerman.com.
Janet, thanks so much for joining me today.
Thank you. My pleasure.